Hi, I'm James Sutton. I'm a person in long-term recovery, and this is Road to Recovery. Today, my special guest is my good friend, Kabir Singh. Welcome, Kabir.
Thank you, James. Thank you for having me.
Now, Kabir, you're such a busy guy. I mean, you're person in long-term recovery. You're one of the Montgomery County's outstanding citizens, as well as a businessman. It's kind of hard to decide where to start, but I'm going to ask you to start with your recovery story.
So, James, thanks again for having me, and you have it exactly correct in the order that it should be. Is that recovery has to come first for me, and as a person in long-term recovery, and what that means for me. Oftentimes, people in recovery you talk about clean dates, sobriety dates. What my recovery means to me is I haven't found it necessary to use a mind or mood-altering substance since May 1st, 2011. I have been in the process since 2009. I am a quintessential Montgomery Countyan. I was born at what I like to call the original Holy Cross. So I was born there, educated through the public school system here in Montgomery County. And perhaps the only time I stepped outside of this realm here is when I lived in Prince George's County for a little while while I was in College Park. Now I serve on the Alcohol and Other Drug Abuse Advisory Council as well, and I know we're going to talk about that as well. But recovery's first. I'm a recipient of services through Montgomery County as well. So I received services. My only episode of treatment so far, knock on wood, was in 2009 through Avery Road Treatment Centers, which is, of course, Maryland Treatment Centers. Right. And so, organization you're familiar with.
Yes, I worked there, no doubt. I worked there, and really, that's a great organization. It was great experience when I worked there, and then I still, since I stopped working there, I still volunteer there with Tree of Hope. So I'm in there on Saturdays, and I do the family group, and that's a great organization.
It is,
and it's great that you're talking about using the services in Montgomery County, because a lot of areas don't have services, and it sounds like you used Montgomery County services, and it was enough to get you really grounded in your recovery process.
Yeah. So the interesting part about my story was. Sort of at the end of the road for me in 2009 there in July, I had two individuals that came to the house to sort of meet with me. It was my eldest brother and my first cousin. So my dad's brother's son, second eldest son. That cousin perhaps was one of the most pronounced examples of addiction that we had in our family. I had seen him growing up. It had kind of the guy you never want to be like. Mm-hmm. Unfortunately, he lost his life due to complications with his health, and as a result of the disease, November 18th, 2019. But the miracle was that the eldest brother, who really didn't know much about being in the throes of addiction, just really knew about where he could send me, versus the cousin who had been to Avery Road, put the kibosh on the whole. I think my brother was going to send me to Canada or some sort of wilderness program. He was like, put the brakes, send him down the road over to Avery Road. They got everything he needs. Right. And that's how and so that therapeutic value of sort of that's talked about in recovery of one of us to another, the peer experience. I listened to him. It was exactly what I needed.
Right. Good. Great story. I'm glad to hear. A lot of people don't have family to do interventions because we've broken the ties of our family, or we don't have family. So that's great that you had a family that cared about you enough that they helped you get into, the road to recovery. Yeah. Now, since you've been in recovery, is there any particular pathway that you utilize to maintain your sobriety?
Yeah, so I'm definitely in 12-step recovery. and one of the things that you just mentioned was a lot of us don't have family to help us either come to our aid or rescue. But what a lot of us do have are natural supports. And so one of those that I seek to be in other people's lives is one, a member of my 12-step community. But a lot of times that only goes so far. James, you're familiar with these 12-step communities, and there's a lot of traditions based there, anonymity and the like. And so what I chose to do was become a certified peer specialist with the state of Maryland when it was very new. I went about it in 2013. Very altruistic introduction to this business. So like I sort of dabbled in real estate and like did that as an income generator for myself.
Right.
And then decided I wanted to get out of the church basements a little bit and be a little more vocal. So I became a peer specialist in that first lot that came through in 2013. So I was doing groups over there on Goody Drive at the Big House. For those viewers that don't know what that is, it's a men's emergency homeless shelter down at Progress Place. Places you know about.
Known as the Big House, right?
Yeah, it's like a really big house. And then so subsequently, I was doing groups there with some other peers as well through a recovery-oriented systems of care grant. It was very, very. If that's all it became, James, I was good with it. It just so turned out that one of my mentors, Randall Ingate, who's now retired from the county, a great public, a wonderful lady. She had heard that a job was available. For those who aren't familiar with Cornerstone, Montgomery, they deal mainly in the realm of severe and persistent mental health disorders.
They do a great job.
They do. And at the time I was there in 2015, 2016, I had heard numbers of 2,400 served on a yearly basis. Through about 300 employees and anywhere from 50 to 100 interns at 3 locations. But they were establishing an ACT team prior to becoming an ACT team, which is Assertive Community Treatment. You have what's called mobile crisis team status before the state. And so they were assembling a mobile crisis team and they needed a certified peer. And so Randall sort of was like, gave me a little nudge, like, I think you need to move more towards the deep end here, and this might be a good place for you. And so went that story. And a little bit about those and services that are provided here in Montgomery County through Cornerstone. ACT teams address the most vulnerable populations that are very hard to reach. They cannot find the means necessary to even get into one of the 3 locations. I've met clients or patients out in tents, out in the woods. Maybe the McDonald's is a more comfortable place. And things like that. So, and to get them the help they need, the service, access to services.
Right. So, and that's frontline work in there. That's how you cut your teeth. In the business was actually doing frontline work. Right. Now, we talked a little bit about before we got started about ALDAC. So, are you still on the ALDAC committee?
Yeah. So I followed in your footsteps. AODAC, for those who are not aware, AODAC is a council. The county executive, I'm not quite sure exactly what I think it's somewhere numbering around 80 or 90 different committees or councils. Some are considered with the way the water runs off to the Chesapeake Bay, and they're public people that join these councils or committees and are the ear to the county executive. This particular one, the Alcohol and Other Drug Abuse Advisory Council, it's a long one. We call it AODAC, as you just mentioned, James. Focuses. We have our ear to the ground and our fingers on the pulse of alcohol and other drugs, and a lot of topics surrounding that in the county. And at that roundtable are various people: Department of Liquor Control, corrections, law enforcement. There's ex officios, there's a physician, there's a pharmacist, lawyers, doctors, all sorts of stuff. And one of the people seats at that voting member seats is the individual in recovery. And following your footsteps, James, because you did have that position for years, a couple terms, from I remember.
Yeah, 2 terms, right?
2 terms, yeah. So I'm on my 2nd term too. So I'll have to hand the torch over eventually to somebody. but I represent the individual in recovery's voice at that roundtable as we discuss the ongoings in the county, spikes in overdoses, correlations of data, what we should perhaps go. Just last month, because we have our monthly meeting, we had a legislative meeting where we're going over House bills. And should we be proponents or opponents to these particular House bills? And we work on that, writing letters to the state legislature, which are first approved by the county.
Great. And so we're getting ready to take a break, and we're going to come back a little bit and talk a little bit about more about ALDAC, because your position on ALDAC, is it as a businessman or as a person in long-term recovery? It's
a person in long-term recovery.
Yeah. So when we come back, I want to talk about why is that important that we need a seat at the table, to advocate for people in recovery.
Yeah, for sure.
We'll be right back with Kabir, and this is Road to Recovery.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Hi, I'm James Sutton. We're back with Road to Recovery. Today, our guest is Kabir Singh. So Kabir, we were talking a little bit about ALDAC and your role on the committee as a person in long-term recovery. Why is that important?
So, great question, James, and thank you for asking it, because that's where everything begins. Is when we start to ask the questions, we get a further understanding of what it's like to be in a person in recovery's shoes, so to speak. And that's truly the exact nature of, while there are all these people at this roundtable, you have doctors, lawyers, Department of Liquor carries a big stick around here in Montgomery County. I mean, yeah, they're at the table. No big surprise. I mean, the part of the first word in the council's name is alcohol. So they're definitely gonna have a seat. You have corrections there, law enforcement. There's a special agent from law enforcement there that talks about overdoses. So it's very valuable to have somebody who's self-identified as an individual in long-term sustained recovery at that table, to have that voice and that lens into what it's like, sort of not necessarily even on the front lines, but just the experience, right? So very much like we talk about it in the peer realms or in the 12-step realms, a lot of folks there who are textbook read and the like, or perhaps corrections has a lot of interactions with addicts and alcoholics, but the person that's truly lived it needs to be at that table, to have that voice to bring forward about bring down the walls of stigma. The stigma, I think is a big problem, right? Right. Addicts are not often treated that well. Why don't you just stop and things like that. So when someone like me or you is there, we further legitimize the experience, that it's not a moral dilemma, that it is a disease, and it is curable if treated. I mean, it's treatable if ongoing recovery takes place, rather.
Great. Now, are there any is there any legislation or anything that you really are proud about since you've been on ALDAC that you were part of? Did you go to Annapolis, or have you guys really made an impact in advising the county exec?
So yeah, we've advised the county exec on a variety of matters. One particular endeavor was the fact that what I think it might even been right around the transition of your time and mine, and of course one of the people in your cohort over at the Tree of Hope Association, Ed Bunny Rich, and his lovely wife Latanya, carried forward the voice in getting a new Avery Road. Now, while I don't want to go back to Avery Road for another episode of treatment, I hear that it would have been much better to be at the one.
Beautiful.
Yeah, beautiful. I've heard. I haven't taken the opportunity to drive by there, and I think I'm going to do that. Of course, we're amidst a pandemic, and you can't quite do all the same things. But while there has been a convergence of behavioral and mental health, it's not just all. Recovery is all encompassing now. We've moved in a direction of healing from mental health disorders. I think the mental health court was a thing long necessary.
Right. That's very important. Right.
Yeah, a vessel for change. Of course, the drug court's been rolling for a while. As you know, we love to support those people over there as well who are currently in that program in any which way we can. So those are the standouts for me.
Okay, great. Thank you for sharing that. Now, can you tell us about your business in Montgomery County and throughout the state? Because in Montgomery County, you have a very creative service that hadn't been done in Montgomery County until you put it into effect. Yeah.
So here, where I happen to be sitting right now, if the viewers look behind me, I can oversee 270. It's just my very lovely plant that I started growing on day one here. We got our thank you. Coincidentally, we got our license to operate from the state on May 1st, 2017, which happens to coincide with my clean date. It's the very same day. And the very following Monday, May 8th, we took our first client here at Fresh Start Recovery Center. We're across from the Rio, to give you some context. And we're a very sort of nondescript location here. And this is what an outpatient program with housing in the community. So while we offer outpatient services, one of the things we do is an option for housing as well. Because that wasn't previously available at an outpatient level, yet Avery Road, which is an inpatient experience. But otherwise, the county was sort of peppered with small IOP programs and the like. So we have a PHP here. PHP stands for partial hospitalization, and all that. Although that word sounds grand, the hospitalization is in there. There's nothing hospitalization-wise about this location. It's an outpatient. It's just what the state calls it. And you have to do 20 hours of treatment to qualify at the PHP level of care, and or what's called 2.5. And so we're here, we do groups in the center. We got about 10,000 square feet here on the second floor of this building, and a variety of therapists' office and the like. And so there's didactic groups that go on here, psychotherapy, mental health education. So we actually have a PHP here, an OMHC, outpatient mental health clinic status, and then a step down to IOP as well. So folks can stay in our housing if they so choose to. And what happens there, James, versus perhaps another outpatient, hey, Johnny, great day of treatment, go to your 12-step meeting tonight, don't drink, don't drug. We'll see you in the morning. And there is a little level of like this. Right. When they're in our housing, there's a lot more less self-reliance, I should say, and there's some more wraparound services that the propensity to succeed is greatly increased.
Right. I think that structure is really important because a lot of times, like you said, there was no connection between housing and outpatient before you set up your agency. So a lot of times people in Oxford houses would leave outpatient and go and not have, there are no professional services in an Oxford house. Oxford houses are great. It's a great national program, but there's no professional services. So there's no real structure formally, so you're the first one to venture out with that particular model, and it seems to be working.
Yeah, thank you for recognizing that, and I think there's certainly room for others have come into the space since then. I think there's plenty of room for it, and so as you mentioned, Oxford houses are a wonderful resource as well. There's some other groups as well that have houses out there, but they, for lack of a better way to say, they're as good as the folks that are in there. So if the folks that are in there are not, if you get let's say in this particular case, I'll keep it on the guys. You got 6 guys in there, and they all decide to start doing whatever. You're going to have some unmanageability break out pretty quickly without any oversight. And
right.
Yeah.
So now your agent, your corporation is doing some things in some other areas of Maryland too. Did you want to expound on that?
Yeah, thank you for that. So the organization itself, so they all have their own names. In Baltimore County, it's called Foundations Recovery Center. In Hagerstown, it's Awakenings Recovery Center. They all sit underneath an umbrella organization called Amatus Health, Amatus Health. And that's, you could actually access that through amatusrecoverycenters.com. And it'll take you to actually 13 treatment centers in 6 states, but I'm involved in Maryland here, and the three facilities here in Maryland. Hagerstown is a high intensity residential. And without getting too much in the weeds on that, it's what's called a 3.5 level of care. It's state medical assistance, so you can get in there with state Medicaid. They'll give you 30 days, and you'll be in that high intensity program where you're, unlike where I am at Fresh Start, you're in that building there. It's right downtown across from the library on South Potomac Street in Hagerstown. Beautiful building, 30,000 square feet. So you're in there, about 54 beds, and you'll be there for 30 days, and you'll get the services you need, and food, eating, bathing, clean, everything's in there. So in one program. And in Baltimore at Foundations, that's in Woodlawn, so just right there off of Security Boulevard.
Right, yeah.
That's also Medicaid, plus there's some in-network insurances taken there, and that's PHP. And so what, unlike private, Medicaid gives you something that you understand to work with. Like in Hagerstown, it's 30 days, and it's 21-day program. PHP, like here, with separate housing. So you go for 21 days there, and then step down to IOP.
Now let me ask you this, because in the jail where I work, a lot of times we have people returning to Hagerstown, returning to Baltimore. So the Baltimore and the Hagerstown, do you have to be a resident of Hagerstown to go to the Hagerstown, or just Maryland Medicaid? How does that work?
Just Maryland Medicaid. We have folks. We've been open there for a little bit over 2 years, and we're fairly well known at this point. We got folks coming over the Eastern Shore.
Okay.
And the wonderful thing about us, James, whatever the center, if you're coming to a private insurance center like Fresh Start, or one of the Medicaid medical assistance centers, we provide transportation up to a certain distance. Like from Hagerstown, we'll come to Baltimore to get you. So
wow, that's a great
we do
story.
Admissions 24/7, and we I think this already, James. That right at that moment when somebody's willing, you got to be there. It's the room, the operator opens up at 8 a.m. Hey, they're going,
Right. That's so important. Now we're coming to the end of the show, and I'm glad you said that. It's so important to have a person in recovery who understands that window of opportunity for a person that says, I want to go to treatment. They may change their mind at any minute. If you tell them to come back in 2 days, that window may be closed. So we got a couple of minutes left. You want to expound on, what you want to leave the audience with, or that particular topic?
Yeah. So right now we're sitting underneath the pandemic, and while it might feel like it's lifting a little bit, we still got a long way to go, and a lot of damage has been done in the rearview mirror. Folks are isolated. People are hurting. Loved ones have been lost. As I mentioned, I lost a cousin. I just sent a loved one to detox, and it was a day long coming just last Thursday. They're there right now. So access to services is there, and without seeming too self-promoting, if you call us at Amatus Recovery Centers, whether you come to us or not, we're going to help navigate you to treatment. So if it's like another program that makes more sense for you, like a 3.1, which we don't currently have, like that makes sense to you, we're going to help you get those services, because we work with all sorts of folks that are in the industry, in this field here in Maryland. So if you call us at 855-80-SOBER, we can link you up with those services, whether mental health or substance abuse or co-occurring. It is possible for somebody like me who was really at the end of the road, did not have insurance. I thank God for Maryland Treatment Centers and what they had done for me, because there was no Affordable Health Care Act then. So right now, there are more services than ever, although it may not seem like it. Please reach out.
Right. Well, thank you so much. That was a great closing. And I'm so glad that you're part of the new wave of treatment providers that are working together, not just in competition, you know, because I think the whole recovery community is much healthier when we work together rather than in competition.
Agreed.
This is James Sutton. Today, my guest was Kabir Singh, and I'll see you on the road to recovery.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Even though there is so much against us,
you will see me choose to protect myself and my community from the coronavirus by wearing a face covering.
Because it's going to take all of us thinking about one another.
And even with my face covered, you will see me.
You will see me as a mother, a wife, a friend.
As an athlete who gave everything to the game I love.
As a father, leading by example.
As a sister.
An entertainer.
As a champion for my people.
You will see me finding a light in a dark time.
To unlock our creativity and push our craft.
You will see me demanding the space to tell the stories that matter.
As a man who knows that tough times don't last, but tough people do.
Join us in wearing a face covering to help stop the spread of the coronavirus.
Because covering your face is one small act of kindness that has the power to bring us together.